I spoke via Skype with Cherian Varghese. He's the co-author of the World Health Organization's Global Report on Diabetes. And I started by asking him why diabetes is such a growing health problem.
Most of the people with diabetes do not get diagnosed as diabetes in many parts of the world, especially in parts of the world where the health system capacity is very minimal. And that's why it's a silent disease, and it causes various complications and premature death. To go about preventing this, I think one should start by looking at early interventions like promoting breastfeeding, preventing children from exposing to unhealthy food marketing, making sure that they have healthier foods and physical activity in schools. As they grow into older ages, make sure that they have healthier choices available, which are cheaper and accessible. Workplaces should enable them to be more physically active. All of this relates to the fact that the global explosion is a result of the increase in overweight and obesity in the world. So there is a parallel thing happening in the world, is that now 1 in 3 adults are overweight and 1 in 10 is obese. So that is a huge change in the composition of the body fat of people in the world, which is one of the most important risk factors for diabetes.
One of the doctors who read this report said that when you look at the numbers and so many people afflicted, it's happening in countries where they just don't have the access to health care or some of the other things that you might find in more affluent countries. Do you agree with that?
Oh yes, very much. In fact, if you look at the access to medicines and technologies, it is woefully inadequate in most of the low and lower middle income countries. And this hampers everything, because if the diagnosis is not done adequately, that causes problems. Even after diagnosis, if there is no equitable access to medicines, which are generic medicines, but even if they are not equitably accessible, then that causes a serious problem in leading to complications. So countries have to really look at universal health coverage, equitable coverage, and affordable medicines to all people with diabetes. So that is one of the reasons why WHO is also promoting universal health coverage, which includes all these aspects of equity as well.
Let me ask you about the food industry, because there's this call that they reduce the fat and the sugar content in their foods, but we haven't seen them really moving in that direction. Do you think they'll listen once they've seen this report?
We call on all of them to respond, because this is everyone's responsibility. It is not just one agency's responsibility. Food manufacturers have a major responsibility in ensuring that healthier options are available. They are available in affordable manner and also are marketed appropriately. So I think food industry has a major responsibility in this area, especially in a world where people are consuming more and more of processed foods compared to 20 or 30 years back.